Hello, I'm Dr. Kim from South Korea. Today, I'm going to talk about the skin booster and its active ingredients that currently and mainly used in Korea. And also, I would like to tell you the factors that you need to focus on when considering the skin booster: concentration, delivery rate, and synergy effect. What do you think the skin booster is? I think there is no clear definition. In broad sense, everything, making skin healthy. In narrow sense, we usually use this medicine and cosmetics that improve skin, usually used in clinic. What is the purpose of using a skin booster? If you use skin booster alone, it mainly used for this purpose: hydration, skin barrier restoration, rejuvenation, etc. If you use it with the device, it increased the effectiveness the procedure and decrease in downtime and side effect. Consideration: patient considerations: effectiveness, less pain, less downtime, and cost effective. But I think doctor's main consideration must be result, effectiveness. So, depending on the purpose, you can choose the proper skin booster. So, you must know the characteristic of active ingredient that you choose, especially molecular weight or solubility and concentration, which can be effective in the tissue. The selection of the penetration method may vary depending on the molecular weight. However, since we are doctors, we can penetrate in various ways. So I think the most important thing when considering the choice of a skin booster is the concentration. Injection, microneedling, needle-free drug transfer device. If you want to deliver active ingredient with a molecular weight of less 10,000 Daltons, like EGF, to the patient's skin, it can be just possible with a regular plasma device. On top of that, using ultrasound device that clearly have effective intensity for the drug absorption can have a great effect. From here, let's take a look at the active ingredient commonly used in skin booster. First, hyaluronic acid. Personally, I think hyaluronic acid is the origin of skin booster. About 15 years ago, when I started to work in a local clinic, a procedure that restores moisturizing in the skin by injecting non-cross-linked hyaluronic acid directly into the skin began, and is still frequently used in Korea. We call it water shining injection, 물광주사. So why do we inject hyaluronic acid? As you know, the molecular weight of high molecular weight hyaluronic acid is millions of Daltons. And so generally cannot be absorbed into the skin, and even if the high molecular weight hyaluronic acid is about 1%, it cannot be used in general cosmetics due to its high viscosity, bad texture. Therefore, the concentration of high molecular weight hyaluronic acid used in cosmetics is usually 0.1 to 0.01%. And for the reference, when the molecular weight of hyaluronic acid decreased, the ability to hold moisture decreased. And third, viscosity decreased. Therefore, higher concentration of low molecular weight hyaluronic acid can be used in the product. As we know, in wound healing process, they have different roles depending on their molecular weight. In addition, it has already been revealed that the results are better when used together than when high molecular weight hyaluronic acid or low molecular weight hyaluronic acid was used alone. Synergistic effect used together. And although only hyaluronic acid is generally considered in dermis, the role of hyaluronic acid in the epidermis is also important. Hyaluronic acid in the epidermis is involved in keratinocyte proliferation and the re-epithelialization process. So if you have a chance, I recommend you try it right after fractional laser or fractional needle RF. I think you will get a different result from the laser alone. Decrease in crust formation and redness and dryness. And the varied PDRN region. As you know, PDRN acts on A2A receptor, a kind of adenosine receptor. As I recall, PDRN plus Centex Intertrigo, made in Italy, was initially used for diabetic foot ulcers and the like. Of course, my memory could be wrong. Then in Korea, it began to use for skin rejuvenation under the name of salmon injection. And a Korean company modified it and made it into a product called Rejuvan, that you know. Anyway, you can see PDRN has shown many different effects when applied to the skin. Collagen synthesis, anti-inflammatory effect, improve angiogenesis, inhibition melanogenesis. Considering this effect, it is possible to get quite good result when used together with a laser in the treatment of melasma with damaged skin barrier. Okay? In this case, what you need be considered is the molecular weight of PDRN. The molecular weight of general PDRN and PN does not easily pass through the skin under the normal condition. However, as you know, taking advantage of the fact that temporary skin barrier damage is induced after laser toning, artificially lowered molecular weight PDRN can easily pass through the skin through the damage. So I usually observe a mixture of low molecular weight hyaluronic acid and low molecular weight PDRN into the skin right after laser toning using ultrasound. And it is known that PDRN has dose-dependent effect and has few side effects. So it is good to use it in high concentration if possible. But commercialized product usually 1 to 2%, probably because of the price. But recently, PDRN has been extracted from plants and algae, and its efficiency has been proven well. Then I think the price of PDRN will go down and it will be more freely available. And rising star exosome. What is the exosome? Cells communicate with each other through extracellular vesicles. There are two types of extracellular vesicles. One is ectoderm, that are secreted at the form of membrane budding. The other is exosome, containing various intracellular substance through the process of endocytosis. So, what the exosome contained, that is, from which cells the exosome are obtained. So, the cell of origin is important. Exosomes, which are currently commercially used for the skin, are generally obtained through the stem cell cultured media using ultrafiltration method. It is known that there are many ways to get exosomes, and ultrafiltration is a way to get a large amount cheaply. As you see, first the cell and cell debris are removed through the filter. After removing the free protein, the remaining portion is through a 100 nanometer filter. So the remaining part is considered as the exosome. The substance obtained in this way can be identified by biomarker of exosome through proteomics, protein analysis. By analyzing exosome obtained using stem cell cultured media, these various growth factors components can be identified. Therefore, in general, expected effects of exosome are as follows: rejuvenation, anti-aging, whitening, hair loss treatment, anti-inflammation, and etc. So, when I make exosome product, I think it is effective to reinforce the related growth factor in the product. And these are others commonly used in the skin booster. Vitamins. Since the skin booster mainly contain water-soluble substance, so we use water-soluble vitamins. Vitamin B3, niacinamide, B5 dexpanthenol, 6 pyridoxine, 7 biotin, 12 cyanocobalamin. Vitamin C and derivatives. Since vitamin C is easily oxidized and its absorption rate increased lower acidity beyond the normal acidity of cosmetics, if it is made with care, I think it is better to use vitamin C derivatives that are more stable for oxidation and more effective at intermediate pH. And I love vitamin B5. As we know, 5% of dexpanthenol has the same anti-inflammatory effect as 1% hydrocortisone. Of course, depending on the formulation of cosmetics, the effect may be slightly different. And B5 has an excellent skin regeneration effect. And B6 and B12 are effective in improving perioral dermatitis or atopic dermatitis. And B5, B7 are helpful for hair loss treatment. Amino acid complex are used as coenzyme for cell metabolism and usually used as a natural moisturizing factors in cosmetics. Sometimes arginine, alkali amino acid, used as a pH adjust agent. Lastly, biostimulator. Biodegradable and biocompatible material like PLA, polylactic acid, PCl, polychloractone, PDO, polydioxanone, are used as the biostimulator in the skin booster. These substances induce a foreign body reaction and subclinical inflammatory reaction by phagocyte, like macrophage. It is generally accepted that the larger particle size, the greater volume formation effect. But recently studies have revealed that nano-sized PLLA also induced collagen formation in the skin. Large-sized PLA, such as Scotra, cannot be phagocytized by macrophagy and must be surrounded to form foreign body giant cell. So it takes time to induce collagen synthesis. Whereas small-sized PLLA can be obtained can be eaten by phagocytes and secrete cytokines such as TGF-beta, induced immediate collagen synthesis from fibroblasts. Such a small size has the potential to induce collagen synthesis quickly, but downside is that it decomposes faster in the skin. So I think this is an area that needs more research in the future. Anyway, this biodegradable material generally leads to better results, long-term treatment maintenance than razor alone. Now, last clinical case with the skin booster. Side effect of long-term use of steroid over 20 years. 20 years. The patient's daughter was originally my patient, and she persuaded her mother, who lives in the Provence, to come to Seoul. It is thought to have started with allergic contact dermatitis. Chronic allergic contact dermatitis and typical side effect of steroid. Rhinogenification, telangiectasia, severe itching, and dryness. She was afraid to use steroid, but she was using steroid every day because of severe itching. So we set a plan. The most important thing is to find worsening factors and modify her lifestyle. I call it skin correction. Skin correction. Especially face wash, friction, face washing time. Cosmetics are instructed to use only face wash, toner, moisturizer. The goal is to minimize the tightness right after washing her face. It means that she did minimize the damage to the skin barrier. Topical steroid use was limited to 1-2 times, once or twice per week. We aim to reduce this as much as possible. Only antihistamine were prescribed and taken when needed, especially at night. Every time she visited, I identify her symptom and apply the appropriate skin booster and ultrasound. She couldn't come more after 8 visits because of long distance. I have tracked her symptom by phone or message once a month. She said she is satisfied with just being able to live without steroid. 8 visits, 1 week interval. I used ultrasound, high molecular weight hyaluronic acid, and low molecular weight hyaluronic acid, modified PDRN, B5, B6, B12. I suggest use to moisturizer with dexpanthenol B5. B5 with 5%. Telangiectasia decreased. And this patient was also brought to our hospital by her daughter. She has been using steroid 2 or 3 times a week for 13 years. She said her skin was always itchy and stung. Even after applying moisturizer, it still stung. And even after applying steroid, some of it subsided and some of it was more itchier, very itchier. She has been taking and applying medicine habitually, and this time she said she developed an allergy after using sunscreen, and it got worse after using steroid. The more severe symptom after using steroid was generally thought to be allergic and irritant reaction to propylene glycol. Propylene glycol is classified as a moisturizer, but is actually used as a penetration enhancer in many cosmetics and medicine. In 2018, it was selected as Allergen of the Year by American Society of Contact Dermatitis. The reason why this case is difficult is that topical steroids prescribed in Korea have not yet been marked with or without propylene glycol. This patient was unable to use topical steroid and cosmetics contain polyur. Polyur means polyalcohol, mainly glycerin and glycerin derivatives like propylene glycol and butylene glycol. The problem is that these ingredients, glycerin, propylene glycol, butylene glycol, are included in almost all cosmetics. Skin boosters may also contain this ingredient, so I should always look at the patient's symptom when using them. So it is advantageous to choose a product that contains enough anti-irritant like B5, vitamin B5 in the product. This patient has decided to correct chronic steroid use habit while currently calming acute inflammation. Skin correction, skin booster with ultrasound, and I choose Vaseline as the main moisturizer in this case. Petrolatum Vaseline. The case I just showed you are a bit extreme, but I believe if you understand and use skin booster well, you can also get better result even in disease treatment. Thank you for your listening. And also thank you for the taking the trouble. Oh, my bad English. Sorry. This is over. My lessons is over. Thank you.